questions in about 10 minutes. We're going to take all the questions right after Dr. Vesole gives his talk on the ABCs of multiple myeloma and perhaps some of the new innovative clinical trials that might include immunology.
He's back. Since I'm the oldest one here, I have in a sense a longer perspective. So I want to cover. We keep talking about clinical trials. We're talking about this because we want to help you get better, and it's for you personally and the next generation of patients to get better. I want to explain the basics of clinical trials to everyone. So let's just say Mary here has a headache, which I probably give her one. And the standard care for Mary's headache is to take an aspirin. Everyone would agree that, Tylenol, aspirin. Let's just say it's aspirin. Well, down the street, they've got a new biotech company who's trying to create a new pain medication for headaches. We'll just call it Drug X. So we need to test and find out if Drug X fixes Mary's headache. So the first part of a clinical trial is we call phase 1. And in phase 1 trials, they're very small trials. Usually only between 20 and 30 patients are in phase 1 trials. And in phase 1 trials, they take Drug X and they give the first 3 patients 1 pill of Drug X to see if they tolerate it. And the second group of patients, they give 2 pills of Drug X, see if they tolerate it. The third group, another 3 patients, they get 3 pills of Drug X, see if they tolerate it. And what they found when they did the fourth group of 3 patients, one of them had a bleed in their head. They said, too much Drug X. Therefore, the most that people can tolerate is 3 pills of Drug X. Phase 1's done. Phase 2 is to take Drug X and take, depending on the trial, let's say 40 to 60 patients, and we're going to give 40 to 60 people 3 pills of Drug X and find out if their headache gets better. So if it doesn't get better in general, 20% of the people, then we say the drug doesn't work and they ditch it. Okay? But let's say that 3 pills worked in 50% of those 40 patients. 20 of them said their headaches got better. The drug company gets very excited. They say, oh, we need to take this to phase 3. In phase 3 trials can be anywhere between 300 and 3,000 patients. And if you're dealing with headaches, could be a large trial. So in phase 3, computer picks whether you get aspirin or you're going to get 3 pills of Drug X. And they follow these patients for a long period of time to see what their headaches are, to see what side effects they have. Did they get stomach upsets? Did they have bleeding? Did they get nosebleeds? And then they find out if Drug X works as well or better than the aspirin did. But sometimes Drug X doesn't work better, but it has less side effects. Aspirin, you all know, could cause stomach upset, could cause stomach bleeding. Drug X causes less stomach bleeding, and it works on headaches. So then the company says, oh, this is really exciting. We've done our phase 3 trial in 1,000 patients, 500 in each group. Well, we need to take it to market. Well, to take it to market, it has to go through the FDA. The FDA, if there's a unmet need, which is generally the case in myeloma, if there's an unmet need, that means there's no other treatment available. Then they accelerate it. It only takes like 6 months for them to make the decision. But there are, if we're dealing with headaches, there's a lot of treatments for headaches. They're going to say, oh, it's just another headache pill. We're going to just put it through regular channels. It takes a year. And after a year, they may say, we like it. We want you to do more studies. Or they say,